Thank you everyone for joining us today. Today is September 28th and it is 2:05 and this is the September Altogether Partners meeting. So today you'll see we have a guest with us. This is Kelli Keck. She is from Epiphany Community Services and she is Epiphany Community Services is the organization that we contract with to do all of our evaluation for the work that we do through Altogether. So like Hillary had mentioned in her email a few days ago, we are headed into year 9 out of 10 years for our Drug-Free Communities grant. So it's really time that we start thinking about the sustainability of Altogether, the work that we do here. So Kelli is joining us to facilitate this conversation today. So we've got a lot that Kelli wants to kind of go over and pick our brains about. So I'm going to just pass it right over to you, Kelli.
I unmute myself. All right, thanks, Andrea. So as Andrea said, we're going to chat a little bit about sustainability and not get too far down the rabbit hole for this particular meeting because we only have an hour and a half. So we're going to start the initial conversations and then perhaps make a request of some of you at the end to become more engaged in this process. I'm going to share my screen. And as Andrea said, I've been working with you guys for a number of years on multiple projects. Right now we have the community survey that's going out. Is everybody taking the community survey? Has everybody forwarded the community survey along to partners? I don't see everyone, but I'm assuming everyone's shaking their head yes. So we're just gonna, it's gonna be a large group conversation, and then depending on how the conversation flows, we may break out into smaller groups because, we've got what, 14 people on? Is that right? Ish.
Looks like we have 13, actually 14 now, but a significant number of those are those of us that are co-staff of Altogether.
Okay. Great. So I'm pretty informal about things like this. So if you have any questions, feel free to stop me and interrupt. If you want to bring up a particular topic, say, hey, I think this is something we need to chat about. I'm all for it. We're a small group. So, let's get started. So sustainability, what is it? Anybody have any thoughts on what sustainability is?
It's about doing something that can keep carrying forward, and kind of works on its, you build in the processes so it works on its own-ish, carries on, I guess. That's the way I look at it.
So it's being able to stay around long enough to see the desired change in your community, right? Are we getting the things done that we want to? Are we able to stay around long enough to make sure what we want to change is happening in our community? And so this whole conversation is going to be driven around where does Altogether want to go around sustainability? What are the things that they want to stick around long enough to do as part of this? So based on your role as a coalition member, what is your responsibility for sustainability? I was excited. No crickets, please.
I guess my responsibility is to stay engaged, is what I think is important, and make sure that whatever is relevant for my organization is connected to to Altogether.
And I'd add like sharing things that we're seeing, like trends or whatever's going on that need to be addressed by Altogether that's appropriate to do so.
Okay, what do other people think? What is your role? Matt, what do you think your role is around sustainability? I'm just going to call you out. Maybe he dropped off. Anybody else have any thoughts on their role around sustainability and sustaining all together? All right. Well, we'll keep moving on and we will talk more about that role. So when we think about sustainability, we think about why is the coalition needed, right? First off, why are we here? What are the things that we bring to the table that other people don't? What is our perspective in the community? And so we have to ask ourselves this question, how does the community view us? Is it in a positive light? Do we do good things and people like us? Is it in a negative light? Have we, upset a group of people and, people are like, oh, all together, terrible group. And are you a resource in the community? How would you guys answer these questions? Do you think the community sees you in a positive light?
I think so.
Okay.
I don't think there's like a negative view. I think there could be more, like, I don't know how many people like would know, like have an opinion, let's say, but I don't think it's anything negative.
Okay. So there are no negative, Nancy's out there.
Oh, I'm sure that there are, but overall, like preponderance or percentage.
Okay. So you guys don't have a nemesis out there that you're not aware of.
Yeah, I agree. I think it's all positive.
Do you think people see you as a resource in the community?
The people that utilize, yes.
Okay. Anybody else have thoughts?
Seriously, this can't just be Lindsay and I. Like, come on, guys.
Stacy.
Even I'm annoyed, and I'm not even Kelly, so I'm annoyed for her.
I could speak up, Margaret Dry here. I was looking for something like this when I met all of you because I was trying to expand a social service from the southern part of the state, working with churches and with substance use disorders. And I was looking for a lot of information and was directed here, and it fit all the needs that I had. So it was a great resource for me.
Thank you, Margaret.
Kelly, I do want to just chime in for folks that there are a number of us on this call who work for Dartmouth Health and are part of the All Together staff.
Right.
So we are staying quiet because we want to hear from our coalition members. So I just want people to know that we are using this as an opportunity to hear from everyone else. We've had some internal conversations, but this is a time for us to hear what our coalition members' thoughts and opinions are. So that's why we're sort of sitting in the background and just taking this all in.
Thank you, Hillary. All right, so we need to, as we talk about sustainability, we'll get more into this. Why is the coalition needed? Is one key component. And we now need to also understand our community's concerns. What do people in our community care about? What are the things that they're passionate about? What are the things that they think that, groups need to be addressing? So we want to be able to understand our shared root causes. We want to be able to understand the interaction between different issues. So, the connection between mental health and substance misuse, right? Those different relationships. And we also want to make sure we're aligning with champions on important issues. So, are there champions in your community on the issue of substance misuse?
You mean like partners?
Yeah, or there's somebody in your community that is just like the voice of substance misuse. They are passionate about it. People know about them.
Yeah, I think there's some for sure, more than one.
Okay. Are you guys aligned?
Do you mean other than service providers? I guess that I'm unsure. I'm unclear of your question.
So are there champions? Are there folks in your community that are the voice for substance misuse, that have a platform that can engage the community, that can engage funders? So it certainly could be like a service provider. But is there a specific person that you guys can think of? I think Angie added somebody in chat.
She said Hypertherm's a business champion.
Okay.
Thank you, Angie.
Right. So these are things that we need to think about as we consider how we're going to sustain ourselves. Want to be connected to the folks who have the ear of people who make decisions around sustainability and where funding priorities lie.
Yeah, I'm an Alice Ely from the Public Health Council for sure. It's not just substance use disorder, but it includes that.
Mm-hmm. So we've got some folks that we know of out there. When we think about sustainability, we look at a couple of different areas. What do we need to sustain? And it's several different categories. So you've got your people, right? We want to sustain educated and experienced staff. Don't say anything negative about Hillary or, Andrea or Lauren right now. We want to sustain experienced and educated staff. We want to make sure that we have volunteers sustained, like all of you guys who are taking an hour and a half out of your afternoon, which we very much appreciate. We want to make sure we're sustaining the structures that we're using, that we're sustaining our work and resources. So any additional actual cash money that you do have available that you're spending on things. So part of that's grant funding or other, line items that you may have in a budget somewhere. So thinking about what financial resources do we need to bring in, and that connects back to people, because most people I know are not going to do their jobs for free. However much they love their job, people have bills and snakes to kill, and so that financial resource connects back to the people. We need to make sure we're sustaining our strategies and interventions. So the things that we're doing, the things that work to create change in our community. And as part of this process, there are a number of steps to developing a formal sustainability plan. So looking at what and where are our current resources? Why do we need more resources? Do we need more resources? And as Hillary pointed out, this is going into year 9 of your DFC. So in, 2 years from now, you're going to have, dropped this fairly big chunk of your funding stream. So do we need more resources? Is a big question to ask. What type of resources do we need in the future? How are we going to get those resources? Who has them? Where do we find them? And then the plan for getting to them. So we're going to start broadly with why sustain altogether. And a lot of this is going to be in, I think we need to do 2 breakout groups. Andrea or Hillary, whoever's setting up the rooms, if you could do that.
Kelly, do you want Hillary, Lauren, and I to be in some of the breakouts with folks, or keep us back?
Why don't you guys can maybe one staff person in each group.
And 2 breakout sessions, you said?
Yeah.
Okay. Just give me 1 minute to do that, please.
Okay. So what we're going to do is I'm going to paste a link in chat once sort of exit out of the presentation, but you're going to have a group of questions. Take notes. I'm going to paste a Google Doc in chat where you can access the questions per activity. So it's already going to be right there for you. Have these conversations as a small group, and then we'll come back together and report as a larger group. You know, there are no right or wrong answers here. If you have questions, post them in chat and we'll try to figure out how to answer them. But, you know, really this is just a chance to talk about why is the coalition needed. So in the first group, you're going to talk about, you know, broadly, why is it needed? What do we do? What happens if we go away? What gaps will be left if we're not there? What do we provide that cannot be placed somewhere else? And how do we know this? How do we know that the coalition is needed? Do we have data to support what we've done? And so this is going to be our first breakout group or conversation. I'm going to stop sharing. So does anybody have any questions? So who wants to share first about what you guys talked about? And we can start with sort of the very first question. So why is the coalition needed?
So Kelli, this report just because we can't use Google Docs on our Dartmouth Hitchcock computers. So for the sake of time, I just took notes on a different doc. So
cool.
so I'll be happy to read them out. But I feel like we had a good, rich discussion in our group. So so why the coalition's needed? From our group, we had mentioned that the coalition is filling a need for prevention work, bringing together resources and people, and then really bringing data back to inform the work plan. We had mentioned that the coalition really helps to keep track of who is still around and who still has staff. So not just within our own like community health team at Dartmouth, Dartmouth Hitchcock, but other organizations, that are doing things around mental health and substance use disorder treatment. Things like that, we're able to kind of stay in the know and be able to update when those sort of staffing changes happen. In terms of from maybe a school perspective, when they're looking at crisis, they're looking for resources and connections for parents, and this is something that that altogether our coalition fills that need. So that's something that's needed. And I think our group is the one that said there is really nothing else out there that is as comprehensive as this coalition, as the work that we do. So I think that's what our group said.
Okay, what about the other group? Anything different? Any disagreement?
No, we basically talked about a lot of the same thing, that altogether is sort of a hub of information, organizations, people to connect to. So it's a connecting resource.
Okay. So it sounds like you kind of answered the what does the coalition do a bit, but do you guys have things you wanted to add for that bullet?
I think we want to add really networking. I feel like that wasn't necessarily captured in the first one, but we try to be, it was recognized that the coalition helps with networking.
Okay.
And I would call it networking with purpose.
Yeah.
I like that. Gonna have to use that.
Our group also talked about the education piece and the trainings that All Together is able to help facilitate and bring to the community. As well as some of the like tangible things like lock boxes, like marketing campaigns, and some of the coalition or the collateral pieces that All Together's produced, some of the tangible items.
Okay. So from your group conversations, what happens if All Together just goes away?
We had that that questions would go unanswered. There would be a gap in prevention, education, drawing people into the work that we do. having a focal point, or excuse me, let me reread what that said. Level of respect and confidence. So knowing that that people are getting high quality information that we can trust. So this trusted resource would be gone. And then kind of having this focal point of all of the information is good. Whereas if the coalition went away, people may have to look at 20 different resources to get the information. Whereas having this one standard location.
Okay.
What else? Name recognition and history. So really helping kind of new people that come to the community, being able to come to this, for example, the All Together Coalition website. It's good for those new people.
What about the other group?
Added that the general impact in the community, as far as how many people we're able to reach, how many people we're able to train, the awareness we're able to increase, the general impact of all of those things would decrease if we weren't out there doing a lot of that work.
Okay.
Yep.
So what are those? Are there other gaps that are going to be left if you guys go away? Very specific gaps, because these two bullets. So what happens if it goes away? And the gaps are very similar. But did you guys, like, hey, there's going to be there will be no lockboxes?
I can tell you that I think it's actually a good thing that more of the organizations are able to access things like Narcan, swag, whatever it is, and get their messages out. I think it's wonderful that we're not the only ones that have those resources. But quite frankly, All Together is the only one that seems to be able to bring the splinter factions together and give them a shared vision. People are doing important work. Different groups, coalitions have really good outcomes for what they're doing, but sometimes they're very, very specific to their focus or their particular community or even a timely issue, whereas All Together has always said, let's gather data, let's look at the data, let's figure out what it means, let's examine trends, let's try to project where things are going, anticipate needs for everyone in different areas, and then we can help troubleshoot. I don't see any other organization as doing that, and I think if All Together goes away, I think people are really going to resort back to the siloed groups where everyone is, trying to do their own thing, sometimes competing or repeating. Maybe we have to look at some things that we do that might be considered redundant, but one thing that we do that is not redundant, it's absolutely unique, is that 10,000-foot view, the grand picture.
How do other people feel about that?
I agree with what Matt said for sure. I think, like, I really view All Together as a hub, and I also view it as a place for people who are. I've been around long enough to know that, like, when there's something bad that happens or there's a trend that's occurring amongst youth or community members, people go to All Together and go, we need to address this. And it's one place. And I think that's really important.
Okay.
Yep, I agree.
Did anybody talk about specific activities that All Together provides that are going to go away? If the coalition goes away, beyond this, collaborative, purposeful networking, one-stop shop kind of thing?
I mean, specifically, I find the newsletter incredibly useful that comes out and the social media posts, and I would definitely be missing both of those.
Okay.
Well, I just talked about, like, the messaging that happens, like, during prom or graduation, like the safe. We can't measure, like, oh yeah, you know, we can say how many people heard it maybe, but how many people are going to like actually do something different because of what they're hearing is harder. But things like that.
Okay. There are specific things beyond this 10,000-foot view that the coalition provides that, you know, you guys feel like you're the only ones that are doing that right now. Okay. How do we know this? How do we know that the coalition is needed, right? If you're going to ask somebody for $500,000, they're going to want to know, like, how do I know that you're doing the right thing? You know, how do I know that you're making a difference? Do you guys have data to support it?
Talking to staff? Are you
In
asking
general,
staff?
everyone, yeah. Or what your groups talked about.
I mean, the DFC outcomes come from YRBS, so we're measuring all our work plan outcomes come from the YRBS data. So, I mean, that's tricky in a sense because by the time we get that data, it's outdated data. But that's really our most utilized data set when thinking about the activities and the work that All Together is going to do. We do the community survey, and we use the community survey results to help understand a little bit deeper into what the community sees as needs. But I wouldn't say that the community survey drives our activities as much as YRBS does.
Okay. But we're able to tell a story of outcomes with both the community survey and the YRBS data. Okay.
That's the hope, right?
Yep.
I don't know this for sure, but I would guess that if we were to ask everyone who was dropping off meds at Take Back Days how they heard about Take Back Day, in the region that All Together serves, I would guess it would probably be because of our promotion and advertising. I don't know that for sure, but we could potentially try and find that out this round.
Yeah.
Because if we weren't doing promotion, I think the only other people doing promotion is the DEA statewide on the radio or something like that, and not all people listen to the radio. So if we weren't promoting that service, we might see the number of pounds disposed decrease potentially in our region.
Yeah, and that's a pretty easy thing to capture. If you want somebody with a clipboard standing out there and just, hey, where did you hear about this? And if it's social media, and you guys just do a tick mark. It's a very boring job, but it's easy to collect.
What about the Narcan trainings and the Narcan? I mean, I feel like it's much easier than some of the other ways you can obtain it.
You know, to return to the question, you know, do you have the data to support our value? You know, Altogether's always been very talented in gathering data and interpreting data, but I don't think our focus has ever really been to justify our existence. And I don't think it'd be that strenuous an activity to redirect some of the focus and say, you know, how do we, you know, justify our existence? I think there is a lot of information. We're giving some anecdotal examples, and I'm thinking of one, and this will sound anecdotal until I explain it a bit. Just recently, I brought to my work a box of fentanyl strips, and that is the equivalent of, 1,000 strips that I brought? And you think about the utilization of these. Are we necessarily going to hear back from somebody that says, I tested something, it turned out to be fentanyl, and I didn't use it, and therefore I didn't overdose? No, we may not necessarily hear it. But the fact is that we have put into play 1,000 strips of fentanyl, which can conceivably prevent 1,000 overdoses. And it's tremendous. And so it's a bit, in terms of hard data, it's quite nebulous, but in terms of potential of impacting communities, it's absolutely incredible.
Yeah.
Yeah, I just put in the chat, what Matt's talking about. We do as a coalition, I think as a whole, and everything that we, provide and promote and share, it's a lot of secondary distribution, I guess, of hard materials, but also information. We're giving the information out to whoever is our first, our first line of contact, and that person is giving it to someone else. So I think that the coalition serves as like that hub of information that then gets distributed to this huge network of people we don't even ever see. So yeah, exactly what Matt said.
I think you could do a lot of like tracing it back, right? So like I do whatever to 5 clients, they do that, but then if you trace it back, so it goes back to me, but then I trace it back to like Lauren. Like there's a lot of trails that lead back to all together.
Without a doubt. There are 3 separate organizations that I supplied to TerraBags to. So, I mean, really, we keep using the word hub, and I can't think of a better word unless we use the word nucleus, because really so many efforts and resources originate with Altogether, and other organizations, groups, individuals are utilizing this. And yeah, Altogether isn't necessarily being recognized for it, other than internally. We know where it came from, and we know its impact.
Yeah. That's something to think about as you move forward in the sustainability process of, we need to be able to demonstrate our value and defining what that looks like. So we're going to go back into the breakout group and talk about, and you kind of already covered some of this in the previous section in this just most recent conversation. But what are the critical needs that your community is feeling? What happens if you go away? And then how do you know this? So again, they're very similar, but this time I really want you to think about those needs that exist in your community beyond this global hub, if you will. Welcome back. I have to turn off my camera because I'm not going to look at myself for the 7 minutes you guys are in for. Nothing that needs to be done. So based on your conversations, what are the critical needs in the community that Altogether addresses? Things that you discussed beyond the previous breakout group.
This is Andrea. I can just share that somebody had mentioned really right now vaping is a critical need, not only in this specific region that person worked in, but across, I would say across the Upper Valley. So, vaping education for students, staff, and parents is just, it's a critical thing right now that this sector is seeing. And some of the other things, I guess, were things that were pretty much already mentioned. And then really, the opioid crisis, I think, when Lauren talked about the secondary distribution, Lauren and Matt talked about the Deterra bags, Narcan, fentanyl test strips, all of those things are really aimed to, address this opioid crisis and reduce access and, harm reduction and things like that. So I would say that's a huge, critical need. And so I don't know if you're looking, for specifics like that of kind of substances, but those are some of the things that were mentioned. That we haven't talked about before in last session.
What about the other group?
Some of the stuff was similar to what we talked about in the previous activity, but it was brought up again, the education and training. There's valuable programming that Altogether puts out, and then the prevention programming was highlighted again. So those tangible things, the Take Back Day, the campaigns, the messaging, the trainings, the events that we're promoting or a part of.
Okay. So specifically, what happens to that education if you guys go away?
My life becomes a lot harder.
Our
Since
group
it's there.
talked about, oh, sorry. Our group talked about how it will just be so much more difficult for the partners that we work with, the organizations and individuals in the community to get connected to whatever it is that they're looking for. And it'll just be a lot harder. And we may not, if we go away, people may not know where to even start to try and ask for resources or how to get connected to a training or that role that we have served. If that's not there, who is going to do it? Is there someone else that is doing it or could do it? It might take a little bit more time for people to get connected to what they're looking for without our hub of resources and relationships that we've built.
Okay. Any other thoughts on, what happens if you guys go away?
I think the ability to serve communities based on their individual needs, because what we said was even between Lebanon, Hanover, and Enfield, sometimes the needs vary. Yeah, we're all in the Upper Valley, but the individual needs of either what's going on at a school versus in different towns, I think that's really helpful that we can be individualized.
Okay. So there's not that other organization out there that has that capacity.
Right.
Okay. All right. Are there other things that you guys discussed in this critical needs conversation that, you think we need to chat about right now?
I'm not sure it necessarily falls under that, but somebody had mentioned, and it kind of goes back to one of your earlier questions, Kelly, about we don't have any, enemies, but there really isn't kind of a call to stop what we're doing, in terms of us putting out the Narcan and the fentanyl test strips and the deterra bags and take back day. Nobody's screaming for us to stop this. So I think that's also, again, not really to answer your question, but I think it's worth noting that.
Okay. Okay. So we're going to hop back into groups again, and when is it? 3:10. Okay. So let's keep this one at 7 minutes as well. But just, what are Altogether's big successes? What are the things that you guys brag about? Things that are a bit more tangible. So if you were to brag to your grandmother that lives in Iowa, what would that brag look like? Thinking about those successes that you do want to brag about, what happens to them, and then how do you know again? How do you know that these successes, you have these successes? Does that make sense to everybody?
Mm-hmm.
Yep. So I want everybody to come back with a big list of everything they're proud of. That should be easy for you guys. So what are the things that you guys bragged about?
You want to just read from the lists we made?
Sure.
Okay. So our group talked about the growth in the coalition, how large the group has grown and the network that has grown within it. The website and the information shared there, social media presence, the fact that other organizations turn to us with questions and needs, that we have sort of acted as a mentor to other DFC coalitions and other groups or communities interested in applying for the DFC. The Circle Up group was sort of born out of this coalition or group, I believe. Trainings and resources to frontline agencies such as schools. The suicide prevention trainings that we offer directly meet a need in the state of New Hampshire as far as their school mandate that everyone has to be trained. And then monitoring the substance use trends from the YRBS and other data reports that we get. Legislative advocacy that we've done in the past. We talked a little bit about how Altogether, was not solely responsible for the outcome, but that we participated in some advocacy and support around the YRBS bill, not changing to an opt-in survey. So that was something that Altogether as a whole was involved in, and we
provided opportunity for our members to, call in their support or testify or whatever. We kept them updated on that process. I think that's all for our group.
Okay. What about the other group? Well done.
Yeah, so some of this, I apologize, might be repetitive, but we shared it at one organization, a recovery-friendly workplace. We have multiple associates and multiple shifts that have been trained in Narcan and have access to Narcan and have these nalox boxes at the organization. And while Altogether did not pay for it and did not, we weren't the main driving source. We were sort of a partner and able to provide knowledge and partner on that initiative. And then also holding a specific drug take back day event at that organization. So again, really bringing this idea of recovery friendly and bringing these things to the associates at this organization to really increase their access to these sort of resources. We were able to bring information to the partners about the 988 switchover, and they in turn were then able to relay that to people in the community. So helping to get that word out. We were able to bring some education on HIV, HCV Resource Center out to people. And then we had mentioned in, having some of this funding, we've been able to connect with local businesses that are not typically part of kind of the work that we do on mental health and substance use disorder. We have a more robust social media, e-news type thing. I think Lauren maybe talked about, I think she talked about, suicide prevention training, specifically the Connect Suicide Prevention, Youth Mental Health First Aid, supporting local coalitions, whether it was coalitions in the past that have since dissolved, or I know somebody mentioned Circle Up and others, and then really the ability for us to break down the youth risk behavior survey data and present that in a digestible way to parents and adults in the community, caregivers, to school boards, to school staff. So really being able to present the information in a way that the specific audience will find useful.
Okay. And does that list feel more tangible than the larger conversation you had earlier? So if someone were to say,
So, yes.
here are successes, you could actually bullet off a number of them now, part of this. Okay. Share my screen because we have 9 minutes left and I want to be very, very respectful of everyone's time. So the next step in this process is to think about the resources. And we're going to ask if a few people are interested in serving on a small ad hoc committee, very, very short term, a handful of meetings. Nobody's asking for your firstborn child or like a vial of your blood. Just a very short-term committee or work group to further the sustainability conversation. And part of that is to think about the resources. So what resources do we need and what resources do we have? So here's what we have in this hand. This is going to go away. Here's what we're going to need to balance that out. Thinking about in a very structured way, how are we going to get them? Going beyond, well, let's write a grant. What do we want to fund? Who's going to write the grant? Who's going to house the grant? All of those specific pieces. Where are we going to get them? And then going through again that list of current resources of people, in kind, material, financial. So just quickly, can anybody name out any of the in-kind support that you guys have? Should I have started with people? Can you name the people resources that you have?
Kelly, can staff answer or no?
Well, I mean, there are 3 people on here that are your people resources.
Well, that's what I mean, beyond the people we're seeing, their faces, I'm confused.
Well, no, I was just trying to get somebody to, people was the easiest one to answer.
Well, are you talking about employees? Or are you talking outside of employees?
Both. Yeah.
So who are the
Employees.
stakeholders?
Exactly. Exactly. So then we need to think about in-kind resources, and one of your grant funds requires a match of resources. And so you guys, is it 187 this year that you have to match?
A little less.
Okay.
But our largest in kind comes from Great Eastern Radio. Bob does give us some radio time, and then Dartmouth Hitchcock contributes pretty substantially to our DFC match.
Okay. Then we have materials and then financial. So DFC is one of your grant funding streams that will end in 2 years from today, actually. Not to bring a big downer on this actual date, but yeah, 2 years from today, the end of this particular grant.
Do you have a pool of volunteers?
Our coalition members are our pool of people resources, stakeholders. They are our stakeholders.
So the next steps would be to establish a short-term planning committee. We don't want to put anyone directly on the spot here right now. You know, I don't want to like dead eye Stacy and peer pressure her into saying yes. But you know, if you feel like you're really passionate and want to help with the sustainability process, feel free to speak up now, or you know, Hillary can reach out to everybody individually offline. But again, short term, trying to get a plan in place. You know, it's a much stronger ask if it's coming from the coalition versus Hillary with her hand out looking like she just wants to keep her job.
When does it have to start? The work.
I mean, it probably a meeting before the end of the year, I would say.
I would love to have a written sustainability plan, a formalized sustainability plan by the end of the year. That's my goal. Because we are year 9 starts on Monday. So we are in that. Kelly says we've got 2 more years. We've got year 9 and 10. We will be in that first of 2 years on Monday. So I would like to get something written down before the first of the year, or at least have a good draft. Maybe not something finalized, but a good solid draft before the first of the year.
So
you think I could be helpful? I'm happy to do it, but I cannot do it before November.
Okay.
So it's totally up to you.
Thank you, Stacy.
What would be the responsibilities of the committee?
I think well, Hillary, you go ahead. You know what you're thinking.
I'm thinking, I mean, our coalition meetings are every other month. Our officers meet on the month that we don't have a coalition meeting. So we've got 1 more coalition meeting in this calendar year. Our next coalition meeting is in November. I would love for an ad hoc sort of sustainability committee meeting to meet once a month for the next couple of months, for an hour at a time. I don't anticipate this being a large ask for folks, because a lot of this stuff we will need to figure out internally as well. But I really would love to have as many opinions and voices from our coalition as possible in these conversations.
So I'd like to offer some help. I'm limited in knowing the hands-on work and the feet on the ground work, but I'd be happy to look at the more structural part of have you considered this, and if I know something, is that in the document itself or helping with the document? But I don't have, as you know, firsthand knowledge exactly of all that you've been doing because of my newness. But if you can find a way that I could help, I'd be happy to.
Thank you, Janet.
Sure. Mostly in the structural part of the organizational of writing it, or kind of taking an eye at, have you got everything in it that you need?
That would be very helpful. Thank you.
Sure, if I can be of help.
That sounds very helpful. All right. So right now you've got two members of this ad hoc committee. And then, working out that plan for the group and bringing it to the larger coalition to say, okay, here are the things that this committee says we need to work on. Who's going to help do what? So it's not just this committee who's doing all of the sustainability work. They're just helping get the plan in place
My meeting's almost over.
so that we can move forward within that 2-year time period. So I believe it is 3:30. Anybody have questions for me? The team has my contact information, so if you want to reach out, feel free to do so. I appreciate you guys taking the time, and I know breakout groups aren't always everyone's favorite, so thank you for doing that. I think we had a good conversation.
I do want to let people know too, so there were a number of coalition members who were not able to join us. We do plan on reaching out to our whole coalition and we want to hear from everybody. So we are offering to have one-on-one conversations with those who were not able to attend today, just to make sure that everyone has a chance to lend their voice to this process.
Well, thank you. Excuse me. Thank you, Oh, I'm sorry. Go ahead, Margaret.
No, I was just going to say thanks very much, and I'm signing off.
All right. Thank you. So please just look for the follow-up email because, like mentioned, we didn't have time to give any updates, and there are some important things coming up in the month of October that we want everybody to be mindful of. So please just when email please some time to look at it. Take some time to look at our newsletter because that'll have some information in there for you as well. And so a big thanks, Kelly, for coming here and starting this conversation and helping to walk us through these activities. It was helpful for us, and we really appreciate it. Thanks, everybody.
Thanks, everyone. Bye. Thank you
you,
very much,
everyone.
Kelly.